the dog side. So the dog side is the venture providing animal-assisted interventions that I've started. We started with the venture in 2020. We registered in early 2021. It's a registered startup as well. So the intention behind registering a startup called the Dog Side was, see, I've been passionate about animals for as long as I can remember. And psychology, of course, I think I've studied psychology for 8, 9, 10 years, and I've taught for over 5 years. So I think it was trying to bring a combination of the love for animals and psychology together, which made me start off with animal assisted interventions. And we started during the pandemic. We started bang in the middle of the pandemic. So we've had a few clients. We've had sessions with a few special schools, etc. We primarily work with special needs children. I'll get into the details soon. But more than that, I think what we ended up doing was we became a platform creating awareness about animal assisted interventions. So we've done sessions with organizations all over India, with different universities, with different other organizations like Wings. And I'm really glad to have this opportunity to, you know, talk about animal assisted interventions and talk about animal assisted therapy. Animal assisted therapy is only one part of animal assisted interventions. That's what we'll be talking about. Before I start off, do any of you have any questions or anything that you want to know before I start the session? Do you have any preconceived notions about animal assisted therapy? Have you ever come across animal assisted therapy, or have you seen the use of animal assisted therapy? Have any of you experienced any of these things? We'll just take like 5 minutes for that and get into the session. Or have you come across therapy dogs? Have you heard the usage therapy dogs? Any of that? No one? Okay. Okay, I think I'll move on to the presentation, and just give me a minute. I'm sharing my screen. Can you guys see my screen?
Yes, sir.
Okay. All right. So this is basically animal assisted interventions. I will uh, some of the topics might not be mentioned in the PowerPoint presentation, but feel free to ask me questions, or if you want to wait till the presentation's over, that's also fine. But I'll just introduce the concept of animal assisted interventions. Now, animal assisted therapy is a small part of something of a bigger umbrella term known as animal assisted interventions. And as the name suggests, animal assisted interventions are those interventions in which we use therapy animals. It's not always therapy animals. It's not always certified therapy animals. It's just we use the presence of animals to work with different situations involving humans in therapy, etc. So the first most commonly discussed type of animal assisted intervention is what our workshop is today. It's called animal assisted therapy, right? So animal assisted therapy is an alternative or complementary form of therapy. The idea here is it's not a fully fledged therapy in itself. Okay, somebody's raised their hand.
Yeah, it's me.
Yeah, sure.
So, your question was, does anybody know about animal
Yes,
assisted therapy? I'm
yes,
sorry, I'm answering this late. I had a internet issue.
no problem.
So, I'm in grade 10 and I'm currently studying in MGIS. And
Okay,
as part of our project, I am conducting an animal assisted therapy workshop in my school.
okay, that's nice.
So,
Where is
I'm here
this?
to know about, sorry.
Where is this? Where is this located? Where are you doing the workshop?
Um, it's in Ahmedabad.
Okay,
It's
okay.
yeah. So I'm conducting, like, I want an organization to work with me and conduct 2 or 3 sittings in this year. So I'm here to know about animal assisted therapy. So I have an idea what is it. I'm studying it for like almost 6 months now. So yeah,
That's really nice to know. It's nice.
yes.
Okay. All right. So if that's it, we'll just move on. So yeah, like I was saying, animal assisted therapy is first thing you need to know about animal assisted therapy is that it's an alternative or complementary form of therapy. All right. I am sure at least some of you would have come across a lot of places advertising animal assisted therapy, saying that they provide animal assisted therapy, etc. Now, what you need to understand about the therapy part is animal assisted therapy always complements another form of therapy. It can be physiotherapy, it can be psychotherapy, etc. In itself, right? Just interacting with the animals itself is not technically animal assisted therapy. That's animal assisted activity. We'll get into that. So, animal assisted therapy is an alternative form of therapy in which an animal is used to make the client feel better. This can be both physically, mentally, emotionally, socially, etc. And animal assisted therapy, unlike the other forms of animal assisted interventions, is always done one on one, right? It's always one client with an animal assisted therapy practitioner, the therapy animal, and the other therapist, which whose therapy AAT is complementing. So that's animal assisted therapy. Animal assisted education is when we use, so here I'll mostly be saying an animal, but what I personally mean, at least with the dog side, what we do is we practice canine assisted therapy. So our therapy animals are dogs, right? So animal assisted education is when we use a therapy dog or an animal for that matter to either improve classroom behavior. This can be manners such as, staying in one place, not running around, etc., or overall learning. I don't know whether you guys have come across this. There are lots of programs where you will see that children, especially with learning disabilities, learning disorders, are encouraged to speak or to read in front of animals. The reason being very simple, because it's easier for children to, for example, read a book to a therapy dog than maybe to a peer or an adult, for the simple reason that the animals involved in this process are non-judgmental. Not just in this process, animals in general are non-judgmental. You can go ahead and say anything you want. Even if you're not confident to say it, you can still say anything you want without expecting a judgment from the animal. So animal assisted education is widely used, especially in places like US and in lots of different parts of Europe. And then we come to animal assisted activities. Now, this is probably the most common animal assisted intervention that you would have heard of, right? Animal assisted activities are just what the name suggests. Here, you will have animals in the mix. This is used as group activities. You will have this happening in hospitals sometimes. You will have the visitation programs. I'll show you a video of that later. There are visitation programs in hospitals. There are corporates who do corporate training sessions where they bring in that's actually there in India, especially in Delhi and Mumbai. The Furball Story, an organization we have a tie-up with, they've already run a lot of such sessions with different corporates where they bring in the therapy animals and the employees get to play around, just reduce some stress levels, increase motivation levels, etc. Animal assisted activities are always done in groups, right? Because it's not just the one on one, it's the group formation, it's the group activities, it's the socialization that makes it what it is. So animal assisted therapy and animal assisted education, animal assisted therapy is always one on one. Animal assisted education mostly one on one, but can be done with two or more people as well. Animal assisted activities is always in groups, right? And I would also say that animal assisted education is kind of a combination of therapy and activity, because it's not just the reading or the talking. The the children involved are encouraged to engage in different kinds of socializing behavior, etc. So these are some of the different types of animal assisted interventions or animal assisted uh, yeah, the different forms of animal assisted interventions comes under the umbrella of animal assisted interventions. Now, before I move on to what is AAT, I just wanted to take your attention to something else. So we've often heard of uh, at least people who, who have friends abroad, because in India these are not very big, but you would have heard of concepts called emotional support animals, right? Or you would have heard of the concept of service animals, right? I just want to clarify this because before we move on, I want to remove some confusions between the three. So usually, mostly when it comes to dogs, working with people, unless they are like military dogs or working dogs, etc., working with people for the betterment of people, there are three types of companion dogs. One is a therapy dog, one is an emotional support animal, and the other is a service dog. I've often heard people get confused between these three. So just I'll give you a brief of what these three different are and what how is a therapy dog different. All right. Now let's start with uh, therapy dog because that's what our topic is. A therapy dog is a dog, therapy animal, let me call it an animal because we can use different animals for therapy, is generally an animal who is trained to remain calm and composed around the people interacting with them. Okay. They are not trained to do any specific tricks. Of course, you can train them. There's nothing wrong in training them, but the idea here is, for example, if your dog, if you're interacting with a therapy dog, the dog will not come and jump at you. You would have often seen when you go to your friends' places, when you interact with new dogs, when you want to play with your new dogs, you see dogs on the street, walking on the streets, etc. When you start playing with them, they have a tendency to jump at you. It's not to bite you or anything, it's just jumping, playing, etc. They tend to get a bit hyper. You would have seen this often, right? Now therapy dogs are specifically trained not to do that unless the individual wants them to jump on them. They'll come, they'll sit with you, they'll engage with you, but they'll never trouble you. All right. So therapy dogs are just that. They are dogs who are trained to remain calm and composed, who will make you feel at ease. They will not overwhelm you with jumping at you, trying to lick you, etc. They will do all of that in a very mature way. They will do it only if you're okay with it. They will not randomly come jump at you. They will not pull you and run. They will just let you be the guide for whatever activities that you have to do. So that's what a therapy dog is trained for, right? The next set of support animals are service dogs. This, I'm sure, you would have seen in some sort of movies, or even some of you might have seen them in real life. These include dogs like the seeing eye dog, for example, for somebody who is blind, taking them around, dogs who are trained to work with them. This is there also for people who are deaf. There are dogs who are trained to work with people who have specific mental health disorders, like, for example, PTSD, or people who are known to have panic attacks. In some cases, it's even used to detect sugar levels in people. Some service dogs are trained to indicate to their handler if their sugar levels go up and down. So a service dog is always paired to one individual. A therapy dog works with anyone and everyone. There's no differentiation when it comes to age, gender. They can work with a 2-year-old kid, they can work with a 90-year-old person. No problem. But a service dog is generally trained to work with one specific individual because the dog will be tuned to that specific person's needs. I've often seen people get confused between service dog and therapy dog, which is why I thought I'll clear this. Then there is this category called emotional support animals. Now, in India, we do not have such an official concept of emotional support animals, but emotional support animals do not specifically have to be trained in anything. Uh, So the handler or the owner will have to have a note from a practicing psychologist, psychiatrist, medical professional saying that this particular animal is this person's emotional support animal. If they have that certificate, in places like the US and the UK, you can actually take your animal anywhere with you, even on a flight. So, I mean, I don't know whether you guys had seen this a couple of years ago in the news. There was this incident where a lady was trying to take a peacock on the flight. The reason she gave was that peacock was her emotional support animal, and as long as you have a note from the doctor saying that this is your emotional support animal, you can take. And because in India it's not a very valid or a used concept, emotional support animals and service animals doesn't really come much into the picture. But in places like the US where they are accepted, a service dog and a emotional support animal can actually accompany you to a lot of places that you'll be visiting, including offices, etc. Of course, there are differences between these two. For example, service animals can accompany you almost everywhere. Emotional support animals, there are certain limits, there are certain restrictions, but especially on flights, if I'm not mistaken, both these categories are allowed. They can travel with you on the next seat if they're certified as a service dog or an emotional support dog. Right. So just wanted to make that clear because a lot of people do tend to confuse between therapy animals and service dogs. Therapy dogs are never trained to work with only one person. Of course, they have a handler, right? They have one handler who works with them, but along with this handler, so this is the therapy practitioner. This is the animal assisted therapy practitioner who will be. So it's always a therapy dog never comes alone for therapy. Right? That's one thing that you need to understand. A therapy dog would never come alone for therapy. When you're saying that you have a therapy dog session going on, it's always a therapy dog paired with a handler because both these people go through training. All right, the dogs initially go through training at a center where they train therapy animals, and then towards the end of that, the handler is also trained, and every certificate of a therapy animal says that this particular animal has completed this particular training and this particular person is the certified handler of the animal. It's always like that. They always come as a pair. Even me, for that matter, when my boys Thor and Loki went through therapy dog training, I also had to be a part of the training for almost 15 days. And the certificate issued was to me and the dogs. It's never just to the dog. But a therapy dog is trained in such a way that the therapy dog handler team can work with any individual, can work with children, adults, any kind of people. But service dogs, emotional support animals, always restricted to that one person. So in case of the service dog, the owner is the handler and the dog takes care of the handler. That's it. Doesn't go beyond that. All right. Now let's move on to feel free to drop questions in between if you have any, but let's move on to the presentation. Okay, so now we're back to, so we already discussed the different types of animal assisted interventions, and now we come into what is AAT, what is specifically animal assisted therapy. All right. Now, one thing that we need to understand is AAT, like any other psychotherapy or physiotherapy session, is a goal directed intervention. We have, when you start with an animal assisted therapy intervention, when you start planning an animal assisted therapy intervention, you have specific goals and you have specific objectives. Right? It's never that, okay, we'll start, we'll introduce the animal, and then let's see where it goes. Maybe the first session, that's what we do because we have to make sure that the client and the animal, they get together. I mean, the animal will definitely get along with the client, but sometimes, the clients might not be okay with one particular breed of dog, or they might not be comfortable with dogs at all, because sometimes we have to start with desensitization. So the first session is just to see how they gel. But beyond that, animal assisted therapy is a very specific goal directed intervention, right? The only thing is the animal is incorporated as an integral part of the treatment process. And another thing that we need to keep in mind is animal assisted therapy cannot be provided just by the therapy animal and the handler. All right. It's always, like I told you earlier, it's a complementary or more like an add-on therapy. I'll give you an example. For example, if somebody is going through psychotherapy, right? Somebody comes in for counseling, somebody wants to go through any form of psychotherapy. What we would do is we would add animal assisted therapy to the mix, right? And what it does is, when you start interacting with a therapy animal, all of you who've interacted with dogs would understand this. As soon as you start playing with the dog, right? You start playing with the dog, you start rubbing their hair, you start fooling around with them, immediately you will start feeling happy, right? And most people do. Of course, if you're scared of dogs, it's a different scenario. But generally, if you like dogs, you start playing with dogs, you feel happy, you feel good, right? For that matter, even if you see the picture of a puppy or a dog, there's a smile on your face, right? Or a kitten playing. All these things are things that lead to smiles on our face. Now, why is that? What a therapy animal, or what happens when you start interacting with a therapy animal, is something called oxytocin in your body. The levels of oxytocin in your body increase. Now, the oxytocin is what is generally responsible for the attachment between the mother and the child. Right? Oxytocin increases in your body. The amount of endorphins in your body also increases, it shoots up. And endorphins get released in your body when you get a hug from someone you like, a friend, a parent, you know, best friend, etc. So what happens is your oxytocin and your endorphin levels go up, and your cortisol levels, that's the stress part, comes down, and your heart rate becomes stable, right? It becomes much better. So that those are some of the things that happen when you start interacting with the therapy animal. So what happens in AAT is, you already have an existing regime of therapy, let's say psychotherapy, let's say occupational therapy, let's say any form of therapy. You introduce the therapy animal into the mix, and you make the person feel better, right? You make the person feel more comfortable, feel more pleasant. One very specific example I can give you of me using animalistic therapy in my counseling sessions is, there are often times when a person comes in for counseling. I mean, I'm sure most of you are in the psychology field, either budding psychologists or practicing psychologists. You would know that when a person comes in for counseling, especially the first couple of sessions, they might not really be as comfortable as you would want them to be, because they are coming there without knowing what to expect. Most of the times, they do not know what they should tell you, whether they should tell you. They just know that they're there. There are even circumstances where people come in for counseling sessions because somebody has forced them to come, right? So, especially in those first couple of sessions, I often find that when I introduce them to my therapy animals during the session, automatically, when their oxytocin level increases, their endorphin levels increase, their cortisol levels come down, they immediately start feeling better. They don't know why they're feeling better, right? They don't know that it's because they're interacting with the dog that they're feeling better. But there's this automatic sense of being happier that comes in, and therefore they will start wanting to talk to you. Because at least they'll want to interact with the animal, and eventually they'll start talking to you. It's a good rapport building mechanism in the initial stages of AD. Now, this is just one example. It's completely different when we work with special needs children, but even there, I've worked with speech therapists, I've worked with occupational therapists. The idea there is, oftentimes when children come in for occupational therapy or speech therapy, they're not very sure. They don't know who these new people are. They don't know what to expect. They don't know whether they'll be judged, etc. You introduce a therapy animal into the mix, their initial attention will get diverted there, and the child will feel more comfortable. Right? We've even got, like, at present, one of our therapy dogs is being used as part of a PhD research project on effectivity of animal assisted therapy with for children with autism. We We've got one of our dogs who's placed at Autism Residential Community in Vellore, and there's a PhD research project going on. So that is what AAT is, right? It in itself, it's not a therapy. When you combine that with something like psychotherapy, even physiotherapy for that matter, there have been instances where even in hospitals, for example, if a person has to undergo physiotherapy but is not willing to, we've had instances where, asking the same person to take a dog for a walk, they would like to do that activity because there's a dog involved. But if you ask them to walk on the treadmill, they wouldn't. So AAT is always specific and goal oriented, and it is always paired with existing therapy regimes, therapy programs, and other things. And I'll also get into who can practice animal assisted therapy. AT is documented and evaluated just like any other form of therapy, psychotherapy, physiotherapy, etc. You would measure the progress at every step of animal assisted therapy. Each session doesn't generally go for more than 45 to 50 minutes because that becomes too much for the individual and for the dog. The dog loses its focus, so they need a break. But yeah, each session is evaluated, the progress is assessed at each session, just like you would do it in other forms of therapy. And then if it's not working out, changes are made, just like you would do in your regular psychotherapy. Okay. Any questions so far? Anybody has any questions so far? Feel free to ask
Good
questions.
evening, sir.
Yes, yes.
So, what kind of animals can be used other than dogs in animal assisted therapy?
Okay. Really nice and valid question. The most commonly used animals in animal assisted therapy are horses and dogs. Right? The most primarily people give preference to using dogs, but we have a lot of institutions who also use horses. Reason being, horses and dogs are the most trainable when it comes to generally training animals. If you look at animal training in general, most amount of training has gone into horses and dogs, right? So primarily it's horses and dogs, but again, when it comes to access, not everybody would have easy access to a horse. Transporting a horse, etc., becomes very difficult. So because of that, people prefer dogs. But apart from this, there are people who've used cats, there are people who've used hamsters, there are people who've used white mice, there are people who use birds. Right? The only condition when you're using a therapy animal as a therapy animal is that the animal needs to remain calm, and you need to be sure that the animal will continue remaining calm. Believe it or not, there have even been instances, recordings of people using snakes as therapy animals. Again, the person who is attending this session, who is the client, needs to be comfortable. You need to make sure of that. But as long as whichever animal you choose can remain calm without troubling your client. For example, if you have a bird who will stay with your client, who will stay calm, who will not keep biting, who will not keep flying around, but would choose to stay in one place. If you've trained your bird in that way, you can choose to use a bird as well. Same with cats. So it's all about whether you can train this particular animal to remain calm and composed around the client. I hope that answers your question.
Thank you, sir. Thank you, sir. Another question. So, what if they are afraid of that particular animal we are trying to give them?
See, there are multiple ways in which we do. For example, if at the dog side, we practice animal assisted interventions only using dogs. Uh, we have a bird, but she's not very people friendly. She's okay with us. So if somebody comes to us for animal assisted interventions, be it children, be it adults, we will tell them in the beginning that this is what it is. And if the person is completely afraid of dogs, is not comfortable with dogs and does not want to try having a session with dogs, there's no way we would make them go through the session, right? But we would tell them that, you can have a regular counseling session, a regular psychotherapy session, but not an animal assisted intervention because you're not comfortable or you're scared of dogs. But if the person comes and tells me that, but I would like to try this, I would like to still try therapy with dogs, I want to see whether I can do this, I am scared, but I would like to overcome my fear, then we've got something called desensitization that we do, in which we gradually introduce them to the therapy dogs. And we don't perform any specific kind of therapy till they're comfortable, till the client is comfortable with the dog. But if they're not at all comfortable with the animal you're using for therapy, not a good idea unless they are willing to go through a desensitization program and then slowly learn to adapt to these animals.
Yes, sir. Thank you, sir.
Okay. Any other questions before we move on? All right. Okay. So next part is, so we've discussed about what AAT is. Next part is, where is AAT used, right? In what places do you use AAT? So what we need to understand is, as of now, the highest use of AAT is in with relation to psychological services. So which is why you will see that the most common place that AAT is used is in different mental health care centers, because with each different person there would be a different treatment, psychotherapy regime, a psychotherapy routine, etc., etc. So it's mostly used in mental health care center. And like I told you in the beginning, therapy dogs are not trained to work with only one kind of people. They can work with any kind of people. They can work with any kind of therapy. So there are places in US where they have like a resident therapy dog or a resident therapy cat, and with each patient, when the therapist uses a different form of psychotherapy, they would tweak the animal assisted therapy accordingly to make sure that it goes in sync. So it's used in mental health care centers, it's used in special schools, and special schools meaning schools for children with special needs. uh, Even one of our therapy dogs right now, Loki, he is placed with autism residential community in Vellore, where he works with kids who are, I mean, he is a full-time resident therapy dog there. So they don't specifically do animal assisted therapy, it's more of animal assisted activity. But whenever required, when they want specific sessions, then I go, along with the therapist, we do that service as well. Next is hospitals. When I'm talking about hospitals, I'm not talking only about mental hospitals, I'm talking about physical hospitals also. Uh, in places like the US, you will see that therapy animals are widely used in both geriatric hospitals and pediatric hospitals. Right? They're widely used because children relate very much to therapy and or to dogs, to animals in general. They want to play, they feel better. And like I said, oxytocin, endorphins levels go up, their stress levels come down. They're already comfortable when they start interacting with the therapy animal. So it's widely used, and also in geriatric hospitals. Older people also, there are a lot of instances of them feeling much more comfortable with therapy and with dogs in general. As long as the dog is not very jumpy, is not trying to push you down. We've often, even for that matter, at home, right now I've got a husky, a beagle, and a golden retriever at home. So the golden retriever is my mom's dog. He's over 5 years old now. So you will see the difference in interaction between me and, I mean, none of the dogs that I have at home right now are therapy dogs. Our center is based in Bangalore and our therapy animals are there. But even for that matter, even without any training, when my golden retriever interacts with my mother, there's no jumping, there's no pushing, there's nothing. When he interacts with me, of course, there's a lot of rough play, etc. When he interacts with my wife, there's a lot of rough play, but with my mother. So generally, these guys are good with elderly people as well. And when you train them to be a therapy animal, they become even better with kids, with adults, etc. So AAT, animal assisted therapy in specific, is mostly used in these three places: mental health care centers, special schools, and hospitals. Now, before we move on, I would like to show you guys a small video. This is from YouTube of how therapy dogs work at a children's hospital. So just give me a second. I'll show you a short video of therapy dogs in a pediatric hospital. Can you guys see the screen?
Yes, sir.
This is Gordon. He's a therapy dog at Children's Hospital Los Angeles. He volunteers at CHLA because it's a special hospital that only treats kids. It has world-class doctors and is one of the top children's hospitals in the country. Therapy dogs provide relief for those who are in pain. They help motivate kids during physical therapy, distract them during procedures, and provide affection and comfort.
The one thing that makes me happy is when a dog comes to visit. Usually while I'm here, I'm feeling really sick. People try to cheer me up, and nothing really cheers me up. Like, I'll just sit in bed all day and I won't do anything. I love when the dogs come and visit me. It gives you comfort and joy, and it makes your life feel a little more normal.
Therapy dogs visit CHLA every single day of the year. More than 1,000 patients every month get a dog therapy visit. Therapy dogs are good company.
This is Bailey. Oh my gosh. Cutie. A regular hospital visit, if it's like no dogs or whatever, and you're just sitting there, I could say it's boring. Honestly, it's boring. It's really good having a dog visit. It can definitely bring up your spirit. If you're not a dog lover, honestly, if you have a dog visit, it might change your mind. They're so sweet and they're so friendly. When I have pain, if I'm in pain, they're a great distraction. They really do help with my illness.
Therapy dogs love making new friends. They're easy to talk to and play with, and they're also happy if you just want to snuggle and not say a word.
When Stuart first walked in, I was very excited to meet him. Before Stuart came, it was kind of boring and I was a little bit anxious, but after I was more calm and it was more fun. I'm always here for 2 hours twice a week, and it usually is boring and like it feels like 4 hours, but when Stuart is here, like today, it feels like 16 minutes or something.
Therapy dogs don't care what you look like or how sick you are. They just want to meet you.
When the dog came in and everything, I personally just instantly felt better and calmer. They told me to get up and walk, and I ended up walking a lap around the floor. Yeah, having a dog here definitely was special. It definitely helped, and I honestly don't think I would have walked as much as I did without the dog there kind of motivating me to keep going. Even if you're not a dog person, having that companion that even only being with you for a few short minutes, kind of just ends up knowing your pace and what you need, that definitely helps no matter whether you love dogs or not.
Every dog therapy visit is different because every kid is different. The dog's job is to help kids feel happier, calmer, and stronger.
When I'm doing therapy with the dog, it makes it a lot more fun. Doing it myself makes time go really slow. We played soccer. I dressed him up. I was giving him treats. It's really nice to hang out with the dog here. He makes things a lot more fun. And so I really hope I see him next time.
There are more than 100 therapy dogs taking turns helping CHLA patients. All therapy dogs and human owners are volunteers to give their time to help kids feel better.
Sometimes I'm a little bit tired, but I usually cheer up when they come. This dog right here has been really sweet to me. He's the best dog. This little doggy is one of the best ones. They just bring me joy a lot. I love you.
The dog therapy program is funded entirely by donations. Please consider supporting us.
And I hope you guys got to see hear the audio as well. Not a problem. I forgot to ask in between. But essentially, that's what a therapy dog program is about. So you saw kids there with different kinds of problems. Right? You saw one kid who was undergoing dialysis, right? Who's there for 2 hours. You saw another kid who has to go through physiotherapy, who has to walk, etc. Right? So the thing with therapy dogs is just like the kids say in the video, they don't discriminate. They don't care what a person looks like. They don't care how old a person is, what the person is going through, etc. This is just one good example video that I always show in my sessions because it just shows that they are trained to work with all different kinds of situations, and situations would be different for different people. And in some cases, you will see that they don't even do anything. Right? In the video, in a couple of places, you saw that they're just lying on the bed. Right? They're just there. They're the presence of the therapy animal. As soon as you see them, you start interacting with them. They don't have to do any tricks. They don't have to do anything special for you. They just have to be there. And that itself immediately boosts your mood, makes you feel happier. All right. So that was just an example of how they're used in different places. So it's the same. This is a pediatric hospital. They would do the same in a mental health care center, in a special school, etc. But the way each patient is treated when it's animal assisted therapy program would be different. There would be a different goal, objective, etc. when each different patient is treated when you're using a therapy dog. Or else, if there's no specific goal, you're just letting them run around, play, etc., then it's called animal assisted activity. All right. Any questions so far? Any doubts? No. Okay. Moving on to the next part of our presentation. Just a second. Okay. The next thing that people often ask me about animal assisted therapy sessions is who can conduct AAT sessions. Right? Now, AAT sessions are generally to be conducted by a team. It's never one person, one or two people. Of course, it can be one person. For example, in my case, when I'm practicing animal assisted therapy as part of my psychotherapy practice, as part of my counseling practice, I don't have other people involved because I am, of course, a certified handler of our therapy dogs, and I am a certified psychologist. I've completed my PhD and I've been practicing psychology for many years. But if the therapist, for example, there are instances where the handler is only trained to handle the therapy animal, trained to work with the animal, but they themselves are not certified professional healthcare workers. In that case, the handler of the dog will work with a professional healthcare worker. Now, when I say professional healthcare worker, it can be a physical healthcare or mental healthcare professional. Both of this works. right? So it can be a doctor, a nurse, a physiotherapist, or a psychotherapist, or anybody who's working in the professional healthcare area who's certified can choose to incorporate animal assisted therapy into their therapy sessions. So if there is no professional therapist, either physical healthcare or mental healthcare professional, then it's not animal assisted therapy. If it's just, the handler coming with the therapy animal and just playing around with the child with no specific goal or objective, just to make them feel better, but without, a specific goal, then it's not animal assisted therapy. If it is animal assisted therapy, then it needs to be structured. So basically, the professional healthcare worker, along with the handler of the animal, will make a plan, will decide that, okay, these are the different steps, just like you have your psychotherapy, and they will always work together. So the handler will take care of, making sure that the dog is not disturbed, the dog is doing well, etc. And the therapist will take care of the therapy needs, and they'll try and combine that in this. That's who can conduct an AAD session. So again, repeating it, it can be a doctor, it can be a nurse, it can be a social worker, it can be a psychologist, right? Anybody who's licensed to provide some kind of healthcare service, psychological, social, mental, anything. So, but without the presence of a certified or a licensed therapist of any sort, we cannot call it therapy. Then it becomes just animal assisted activity, right? It's just running around and having fun. Okay? Now comes the difference between AAT and the difference between the three different types of interventions we discussed. Before that, any questions? Any doubts? Okay, I think I did mention that I was working as a faculty for over 5 years. And when you see situations like this, when there are absolutely no questions or doubts, I start to think whether it's either because I was so good, everybody's understood everything, or I think that nobody's understood anything and they just want, okay, let's
Sir,
move on
there
with
is a
this.
query in the chat box, sir.
Yes. What was that? Does AAT help with ADHD? Yes. So what happens? I'm not going to talk specifically about ADHD, but rather I'll talk about the different cases, including autism, etc. Reason being, I've not specifically worked with one or the other. The instances where I've worked is always with a group or multiple children, so we've not specifically worked with one. Now, animal assisted therapy, how it works or how it helps children with special needs is that it primarily works on their communication skills and their socializing skills, right? Now, most of the times what I've found is children with special needs, be it autism, be it ADHD, they have trouble in communicating and they have trouble in socializing. The problem with communicating leads to trouble in socializing. It's all interconnected, right? We often see that they have trouble in these two areas. So the work that I have done personally, of course, our research is taking it one step further right now, is that we start working with these children because even for these children to open up to a therapist, to open up to a counselor, to open up to a speech therapist or a vocational trainer, etc., it takes a little bit of time because they don't know this new person, they're not comfortable with this new person. It takes time to trust this new person, etc. So what we've done so far is we work on their communication and socializing skills. So how it generally happens is, when a child comes in, we start with animal assisted activities. It's generally a group activity where they all run around, play peekaboo with the dogs, play hide and seek with the dogs. They do all that. And then once they're warmed up to the dog, once they're comfortable with the dogs, we bring in the therapist. We take the child aside from the other children. It's the dog, the therapist, a handler, in my case, me, the handler, the therapist will be working with the child. And then we start with encouraging the child to communicate with the dog, right? Even before starting the therapy routine, we start encouraging them to talk to the dog, play with the dog, take the dog for a walk, etc. So what happens is, over a period of time, these children start communicating with the dog. And oftentimes, these dogs cannot respond back. They cannot say anything back. They just shower you with love, but beyond that, they can't do anything. So then they look to me, because they see that the dog is coming to me. I'm the handler. They start communicating with me. So it starts their communication. They become more open to communication. And then, they start talking to the therapist as well, because they know that, okay, this guy is friends with the dog. So the dog is friends with me, so I can be friends with this guy. This is the kind of thing that goes on. And then they start communicating, and the therapy process itself becomes better. And then what happens is, in this process, they've already started interacting with two new human beings. One is the handler of the dog, that's me, and the therapist, because we're all friends with the dog, right? So you will see that slowly they become more and more comfortable with interacting with others. Sometimes we even we've had this one instance of a child who was very scared to go into a new room or an empty room, climb stairs alone, etc. We've had a couple of children who had such issues. What we do is, we just interact, build rapport, and then we just take the child, give the leash of the dog to the child, and slowly start taking the child to different rooms. First, we'd all go as a group. Then we'd ask the child to go explore by himself or herself. And then it would reach a point where, the child would slowly start realizing that, okay, I went here with a group of friends. Now I went with my friend, the dog, and it's okay. I can handle this, right? So what happens is, in ADHD, autism, etc., primarily animal assisted therapy works with the socializing and the communication skills of the child, right? Of course, there are very specific therapy programs which go beyond communication and socialization, but personally, I've not used any of them. Because my expertise primarily ends there. And it's always that I work with special educators or speech therapists or such people who are licensed to work. So the problem when you're working with, or the concern when you're working with special needs children, is I need to have someone with me, a therapist, who is licensed by the RCI to work with children. Right? It's not that I can just call another psychologist and go, a child psychologist. This person needs to be licensed by the RCI to work with children. Right? So again, very specific situations. But yeah, I hope that answers your question. It is the communication and socialization is primarily what I work with. Okay. Glad. Any other questions? No? Yes. Like I said, either everyone's understanding every. Yes, I got someone.
For which all disorders it is used, and which can be used in an efficacious manner?
See, as of now, it's been used across a whole variety of disorders. In children's cases, it's been used even with children with cerebral palsy, but cerebral palsy, it's primarily working with horses, because the horse ride seems to be more effective for children with cerebral palsy, but it's used for the whole variety of different cases that children have. And when it comes to adults, again, it's been used with anxiety, with depression, with schizophrenia, with Alzheimer's. I mean, research indicates that, when you have a patient who's got Alzheimer's, usually they lose touch with reality. But research has indicated that in the room with the therapist, with the dog, etc., they somehow are able to maintain that connection with reality, because they're somehow able to maintain their connect with the dog in the room. So there have been a lot of studies, and I think there is no so far in all the studies that were done, animal assisted therapy was found to be useful in all the different kinds of psychological disturbances, primarily because the dogs are not really doing anything. right? It's not that we are expecting the dogs to do something, you know, do a particular trick or anything like that. It's just that their presence is there. So it's just that when, for example, if I get up in the morning, go out, right, having a cup of tea sitting in front of the house, I have my dog right next to me. Or if I go to the balcony, I've got my other two dogs there right next to me. It's not that I want them to do anything. It's just that their presence is there. I know I'm rubbing their necks and rubbing their heads. It makes me feel better instantly. Right? So it's ideally you can try using animal assisted therapy with any kind of a situation, except in cases where the client is extremely scared of a dog, or they've had previous traumatic experiences where a dog has tried to bite them, scratch them, or any such experience. In that case, not a very good idea to try and use animal assisted therapy. But there also you have the option of desensitizing, right? And the best part when you're trying to desensitize someone to dogs using a therapy dog is, most people, when they see a dog, why they get scared is because dogs are big, you know, they jump on you. I mean, literally, I can tell you, I have a golden retriever at home. So my golden retriever stays downstairs and my husky and beagle stay on top. So husky and beagle are like mine and my wife's dogs, and the golden retriever is my mom's dog. So the golden retriever downstairs. Anyone who knows what a golden retriever is will know that they'll not do anything. All right, they'll just come. And my retriever is so pampered to the extent that you cannot take your hand off. So if you're scratching his belly, you're scratching his neck, you cannot take your hand off. If you take your hand off for 10 seconds, he will bite your hand, not hard, but he will bite your hand and he will put it back in the same place and say, scratch me. Okay. Now that is a golden retriever for you. But when a person from outside the gate sees my retriever, he's a big white dog, right? Golden white kind of dog. People get scared because that is the only concern I have when using animal assisted therapy. When you're trying to desensitize. Now, my retriever is not so trained to be a therapy dog. Right? This guy is just a normal pet dog. So he doesn't know that he has to be gentle, he has to be calm. He will go jump at anyone he sees when he wants to meet them. So I cannot use him to desensitize anyone. Right? If I'm trying to use him to desensitize anyone, as soon as they come inside the gate, they'll run outside the gate because it's a big dog trying to jump at them. But when I use my therapy dogs, they don't jump. They'll come right next to you. They'll sit right next to you. They'll sit where you are. If I give them the leash, they'll walk with you. They'll do all that. So then desensitizing process becomes easy. So if a person is not desensitized to dogs, you'll have to start with desensitizing them. But otherwise, unless they've had any specific trauma related to dogs, I personally felt that you can use animal assisted therapy in all different kinds of situations. I hope that answers your question.
Yes, sir. Thank you, sir.
Okay. I think if we don't have any other questions, we'll move on. Okay. So covered this. Now, how is AAT different from AA and AA? AA stands for Animal Assisted Activities and AE stands for Animal Assisted Education. We've already discussed this, but just going into it a little bit more detailed. AAT, like I've said multiple times, is very specific and goal oriented. It, you guys can see my screen, right? Yeah. Okay.
Yes, sir.
So AAT is very specific and goal oriented. It needs to have a very specific structure. So after the first session, where the client and the animal have built a rapport, then each session needs to have goals. Each session needs to have objectives. And if these goals and objectives are not being met, right? If they're not being met, or the client is not able to perform according to what you're thinking, then each session you'll have to keep tweaking them. You'll have to change. You'll have to change the expectation. You'll have to change the objective, change the goal. Sometimes you will, if your goal is to maybe, let's say, make the person social, you might realize that you have to break that into smaller pieces and then have smaller goals instead of big. So AAT in that way, very specific, very goal oriented. And if it's not meeting, each session is not meeting the goal you had in mind, you will have to reprogram the entire session. Animal assisted activities, on the other hand, has no specific goals, right? It's just done to make people feel better. I mean, best example I can give you is if you like a dog, if you are a dog person, you're comfortable with dogs, and you see a big golden retriever coming running towards you, most people would already be happy. And they see the dog coming towards you, and if you have the opportunity to pet the dog, you become happy, right? So animal assisted activity, that's how it works. Basically done in groups. It's done in corporates, hospitals, schools, etc. It's just where these animals are let out to play with the people involved. Can be employees, can be patients, can be a group of students, etc. Where the idea is to boost oxytocin, boost endorphins, and reduce the cortisol levels in the person. Right? No specific goals. But it's often done to make people feel better, make people feel more motivated. I mean, there have even been studies which say that corporates which use animal assisted activities every now and then have employees who have lesser stress levels and are more motivated to work because of the simple fact that they know that their company does these activities and they'll be looking forward to the next activity. So that's what animal assisted activity is, not specific. It's just making everyone feel better. Animal assisted education is basically when you're trying to help children and create situations where they don't have to face their peers. So one of the biggest problems I've seen, but one of the biggest troubles I've seen when it comes to working with special needs children or just children who have some kind of a learning disorder, etc., is they're not comfortable doing a particular academic activity in front of maybe their teacher or their classmate or their peer, etc. Reason? Because they're afraid that if they make a mistake, what if they judge them? What if they start laughing? What if they talk behind their backs? What if they make fun of them, etc.? So that's where, when we ask them to do the same activity, for example, read a storybook to a dog, they're very happy to do it. They would happily read the entire storybook to the dog. We've done this session multiple times. Animalist education is something that we do on a regular basis. And what happens is over a period of time, they become confident because they see that the dog is not reacting, listening to them, spending time with them. So they realize that what they're doing might be right. And all their fear slowly goes away. And slowly they reach a position where they can perform these same things in front of their peers or other adults. Right? So animalistic education, I always call it a combination of therapy and activity. But yeah, so all these three very different, they have very different objectives and they're done in very different situations. Now, I did speak a lot about therapy dogs not having to be specifically trained to do specific activities, no different tricks, tips, etc. So this next video I'm going to show you is about the skills that a therapy dog should have. So you will understand when you see these skills that these are skills that you can teach a lot of dogs. The only difference is that in case of a therapy dog, while learning all these skills, they need to learn how to remain calm and composed. Simple thing I can talk about is you might have seen a lot of dogs. A lot of you might have had pet dogs in your house, right? What usually happens during Diwali or when there's a bad thunderstorm, right? There's something I've seen in the houses of a lot of my friends. As soon as Diwali crackers start or there's a thunderstorm, dogs get scared. Right? They react in a completely different way. They go under the table, they hide in a corner, etc. Now, a therapy dog is not supposed to do that. They, even if there's a thunderstorm happening right in front of them, there's Diwali crackers right in front of them, if they are with a client, they are not supposed to run. They are not supposed to trouble. So the main difference is they need to have these skills and they need to learn how to remain calm and composed during any situation, be it indoors, outdoors, etc. So I'll show you a short video of the skills. If a dog has these skills and they know how to remain calm and composed, you can use them as a therapy dog. But I'll also talk about what dogs, or what do you need to look for in a dog if you want to use them as a therapy. So what's this short video? I hope you guys enjoyed that particular video, but more than that, I hope you guys noticed that in different places, like when the dog was trying to jump on the other person, dog was pulled back, right? So the idea is not that they do a different tricks or something like that. They remain calm and composed in every environment. If there's a crowd, if there's strange equipment, if it's indoors, it's outdoors, they stay as calm as possible. That's what goes into the training of a therapy animal. They don't do tricks. Of course, after they've mastered all this, you can teach them to play fetch. One of my therapy dogs is taught to play fetch, but that's not part of the therapy dog training itself, but that's just one way to make sure that the participants or the client can play with the dog, etc. So I hope you guys got a brief idea of what is therapy dog training. Back to our presentation, a few more things that we need to talk about. All right, so now we move on to a brief history of AATO, right? So the human canine connection, or the connection between animals and dogs and humans, started more than 30,000 years ago, right? So 10,000 years ago, I think it's about 20,000 years ago that horses and etc. started becoming domesticated, but dogs were domesticated more than 30,000 years ago. That's what history shows us. And this started as wolves scavenging food from humans, and then humans wanting them for protection. It was more of a mutually beneficial relationship between wolves and people. And then over a period of time, there was a lot of specific breeding, etc., etc. And finally we have the dogs that we see today. But the human canine connection is one of the oldest documented connection that humans have with any other species or any other group of animals. And AAT sessions start all the way from ancient Greeks. Of course, at that time, it was more of physiotherapy, and it was mostly horses which were used to lift up the spirits of people who were injured in the war, etc. And the first formal research paper on AAT was started by Dr. Boris Levinson in the 60s. But what happened is, when he initially published his research, people did not take him very seriously because, of course, it's a new area. I mean, even today in India, when we've had discussions with hospitals, etc., people are worried about the cleanliness, about, of course, genuine concerns, but they also should give the organization a chance to see whether this will work out or not. Right? So when Dr. Boris Levinson initially tried to speak about animal-assisted therapy, he was not taken seriously, even though he saw that his dog had a positive impact on mentally impaired patients. But there's a fact that a lot of people don't know. It was Freud and his findings which first brought a lot of attention to animal-assisted therapy. It was after Freud's findings were published that Levinson's findings were considered valid. So even though the first formal research was started by Levinson, the first accepted research on animal-assisted therapy was conducted by the great Sigmund Freud himself. And today I think it's a modality which works with a whole set of different approaches. You can basically use it in any different kind of approach you take, be it the Freudian approach, be it the humanitarian approach. The only thing is you need to tweak the use of the therapy animals according to the approach that you're using. right? You need to make sure that the person doesn't spend all their time playing with the therapy dog. You need to make sure that you meet your specific goals. But apart from that, it has grown a lot today. And it's not only used for the therapy process itself, it starts with the rapport building, it starts with the therapy process. And one thing that I failed to mention earlier was that it's even helped me in places where the client gets overwhelmed during a counseling session. I mean, we would have often seen that you're talking to a client, you're talking about something difficult, and the client is trying to narrate something difficult, and then they might become very sad or very angry and break down or stop talking. Even in those situations, as soon as they start interacting with the therapy animal, they come back to normal, because even though they're feeling sad and angry, their oxytocin and endorphins increase again. Their cortisol, the stress levels come down, and the heart rate comes to normal, and they can resume conversations. Right. So starting with ancient Greeks and then Boris Levinson in the 60s and then Freud, today animal-assisted therapy has reached a point where there are a lot of different ways in which AT can be used. Right. I'll just talk about the benefits and applications of AAT and then move into the concept of working dogs. Just introduce working dogs to you guys. So animal assisted therapy, they use both in pet therapy and animal assisted therapy. So pet therapy is more of animal assisted activity and animal assisted therapy. And these are the most common benefits of working with dogs: heightened problem solving and communication skills by giving the dog commands. Now, this we do a lot with children. When we work with special needs children, we actually teach them to train the dog a little bit. We teach them to, train the dog different tricks, even though it's not required as part of therapy dog programs or therapy dog training. In the activity itself, in the therapy process, sometimes we ask the kids to teach the dog a new trick. It actually increases their problem solving and communication skills, and it helps them relate to others, because often when we're working with children, we do animal assisted activities and therapies, so they have to interact with the other kids, they have to interact with the rest of the crowd, they have to interact with the others to see who gets to take care of the dog, etc. So it helps them relate to others. It also helps them empathize, because sometimes you should see these children in group sessions. Sometimes if the dog goes for water, or is lying down, sometimes these kids come and tell you, oh, the dog is feeling tired, I think we should give it some rest. It basically helps them to build empathy as well. They start understanding what the other individual is going through. It starts with the dog and then moves on to the other participants, to the other members of the group. Improvement in depression or anxiety, this happens for adults most of the time. Greater level of interest and focus, because they relate the activity to feeling happy because of the oxytocin and the endorphins. More positive attitude and motivation. These are some of the documented benefits and applications of AAT. And now I'll just introduce you to the concept of working dogs. This kind of brings me to the end of my presentation with this. And then we have time for question answer sessions, feedback. You want to know further, we can talk about all that. So working dogs is, in earlier days, every dog, every breed you see has a different purpose. Like, for example, I'm sure you've all heard of the breed called the Belgian Malinois. If not the Belgian Malinois, you've heard of German Shepherds, right? You've heard of Golden Retriever. How many of you know that Golden Retrievers were actually hunting dogs, right? So they were used for hunting. Beagles were hunting dogs. Not were, still are hunting dogs, right? So different dogs are bred for different purposes, but over a period of time, those purposes are not being served anymore, right? So when you're saying a dog is a working dog, like for example, my dogs Thor and Loki, they're working dogs. They have a very different routine from my pet dogs. Right? My pet dogs will be let out, free, roam around all the time. They don't have to go through specific training. Of course, I've made sure that some training is given to them as well, but they don't have to do training. They're just part of the family, right? But when you're talking about a working dog, a therapy dog, this is one thing that you need to keep in mind. If you ever consider getting into animal assisted therapy, getting a therapy dog, etc., there are certain things that you need to take care of in working dogs. One, you got to train them every day. Right now, you saw that just the basics, right? Those 12 skills that is required. Not very difficult, but you have to keep working with them on that, or over a period of time, if you don't train them for a week or a month, because there will be times when you're running an organization with therapy dogs that you don't really have clients, you don't meet a lot of people, your dogs are not meeting a lot of people. If you don't keep training them over a period of time, they can forget some of the things, and the next time you meet someone new, they might start jumping at the person, which beats the purpose of them being a therapy dog. It's not like a computer program where you program them once and they're like that for life. So when you work, this is not just therapy dogs, this is any working dog, but I would talk about therapy dogs because that's what I do. You need to keep training with them on a very regular basis. Second is, you cannot let them roam around free the entire time like you would do with other dogs, your pet dogs for that matter. You need to stick to their schedule, right? When they're not working, they're resting. If they don't have work for a couple of days, of course you can do your trainings, etc., with them, but they should, other times when they're not working or they're not training, they should be resting. And most of the times there's a lot of crate training happening. They sleep in their crates, right? So of course, this is not, I do not have the time to cover every aspect of a working dog, but just to understand that working dogs have a different set of requirements from therapy, from your usual pet dogs. They need to have a routine, right? So for example, my therapy dogs, in the morning, 8:30, they're up and they go out for their walk. So, and they have their breakfast once they're back. Now, every plan involving therapy dogs needs to be after that. So if, for example, somebody wants a session with me, I would not agree for a session before 10:30 in the morning, a session starting before 10:30 in the morning, because I cannot disturb this particular schedule. 8:30 they get up, 8:30 they go for their walk, play, come back, eat food, that gets over by 9:30. So any plan I have with the therapy dogs needs to be after that, right? The next thing is, you cannot work them. It's not like, for example, if a friend comes to your house, you have a dog at home, your friend can play with your pet dog for as long as he or she wants, hours together, days together. But with a therapy animal or with a working dog, you need to realize that they are not supposed to be working for more than an hour and a half max in one stretch. You need to give them breaks after each stretch, because otherwise they start losing focus. And also in an entire day, with the sufficient breaks, not more than 4.5 hours of interactions for a therapy animal, because after that they tend to lose focus, and when they start losing focus, then they're not, as calm as you want them to be. They also start getting bored, right? So you need to make sure that you stick to their routine, unlike pet dogs. Pet dogs also, it's always good to stick to a routine, then you have nothing to worry about, but often we don't. But with working dogs, it's very important to stick to their routine. It's very important to give them enough rest. And it's very important to keep training them even when you don't have active sessions. And these are certain things that you have to keep in mind, because otherwise what happens is, over a period of time, if you don't stick to these things, they start forgetting the things that we've trained them to do. And then they're not as calm and composed as they're supposed to be, right? So that's about working dogs. I mean, I can talk a whole 2-3 hours about working dogs, therapy dogs, but I think this kind of brings me to the end of the session that I planned today. A brief about animal assisted and what it is. Are you guys hearing? No? All good? Okay. So what animal assisted therapy is, who can do it, who benefits from it, how therapy dogs are, etc. I hope I was able to give you a brief into the introduction into animal assisted therapy. Now you can ask your questions, you can give me your feedback, etc., etc.
Sir, can we see a therapy dog?
Like I said, I'm in Kerala right now. My therapy dogs are in Bangalore. I mean, we placed them in Bangalore. So, and my dogs have slept for the day. I mean, they were out the entire day. So I'm very sorry. But if you guys want to see our therapy dogs pictures, videos of them, we have an Instagram account called The Dog Side at thedogside.in. You can actually see not only our therapy dogs, you can also see, I'm just leaving the Instagram handle in the chat box. You can actually see pictures of our therapy dogs. You can see a lot of trivia about using other animals as therapy animals, etc., etc. So there's a lot of information there. I mean, our Thor and Loki were even featured by News 18, CNN, the News 18. So I think that feature is also there on the Instagram channel. So you can go there.
Thank you, sir. Okay, so if anyone of you have got questions, I think sir is ready to give you an answer to that. Or you can drop your, yeah, so we have a question now. How many sessions are ideal for a working day?
In a day, 4, max 5. With, see, each session would last about 50 minutes to 1 hour. And after every session, they need to get a solid break of at least half an hour, 40 minutes, where they sleep or they drink water, eat. So you need to also make sure that they're taking rest during that time and not running around. So I would say a max of 4 to 5 sessions. 5 sessions is like when the dog is mature, you know, been doing this for some time. But if the dog is compared, of course, you cannot use a dog as a therapy dog before they complete 1 year, because you can, but you need to have a lot of supervision in place. Ideally, like in the US, they would certify a therapy dog only after they complete 1 year of age. So in the initial days, maybe 3 sessions of 50 minutes to 1 hour each. But as they grow older, by the time they're 3-4 years old, maybe a max of 5 sessions a day, not more than that. Anybody else?
You can drop your queries in our chat box.
Yeah, I was just about to say that. Where you can also contact me on the Dog Side Instagram handle if you have any questions or doubts. We also organize 3-day workshops on animal assisted therapy, but of course that's like an intense program. It's a 9-10 hour program. We also do that every once in a while. It's been a while since we've organized one, but one might come up in the next month or so. So if you have any other questions about animal assisted therapy, about therapy dogs, etc., you can drop me a message on that handle at thedogside.in. Yeah, other than that, I mean, of course, right now you can ask your questions. I'm saying later, if you think of something, feel free to drop a message there.
Does anybody have any queries so that we can go to the next session? I hope we are done with the Q&A session. So thank you so much, sir, for the thought-provoking session. It was really engaging one. Now I would like to call upon Nimi, Marketing and Public Relation Head, for vote of thanks.
Isha. So once again, a warm good evening to one and all present here today with us. So yeah, the purpose of conducting this session was to bring in an introduction to what is animal assisted therapy. And I think almost all of us sitting here, it's a new word for us, isn't it? Animal assisted therapy. Because when I received calls from others, what they've told me was like, could you just brief me on it? Could you just brief me on it? And I just told them, why don't you just join a webinar and understand more about it? We have the best in the team. We have the best in the field to give us a webinar on that. So I think all your doubts are being cleared. You just got an introduction to what is animal assisted therapy is about, right? So moving forward, we have, let me begin by extending my gratitude to Dr. Rex Joseph. Sir, on behalf of me and my team Wings, I thank you so much for coming here, accepting our request, and spending almost 2 hours with us. And I just have to say that it was a wonderful session. It was really a wonderful session, especially with the videos that you've shown. And I think you have spoken in such a way that everyone could understand what it is. Like an introduction was given. I think almost somehow, at least 80 to 90% of their queries are being cleared here, because everyone wanted to know what is animal assisted therapy, and I think you have done that part very well. So it was a wonderful session. So on behalf of me and my team Wings, we extend our sincere gratitude towards you, sir, for coming here from your busy schedule and taking this webinar. So thank you so much, sir.
Thank you.
So moving forward, let me extend my gratitude to Mr. Arun Patamal, CEO and Director of Wings. Sir, from your busy schedule, you are also here with us today. So thank you so much, sir, for being there. So let me move on by thanking. Let me move on to thanking our academic head, Mr. Nikhil. Sir, for your presence. Thank you for being here. Now, let me thank Ms. Anjana. She's our academic coordinator. Ma'am, thank you so much for being here. So now let me move on to saying thanks to our operations head, Ms. Remy. Ma'am, you are the one who has organized all these things. Like, we have started this, I think, almost 1.5 months back, and all thanks to your support and your dedication to conducting this webinar, ma'am. So thank you so much. And you also, Aisha, our team member, thank you so much for the introduction, and thank you so much for introducing me. Thank you. So, but last but not the least, but thank you to all the participants who were here from the beginning. So on behalf of me and my team Wings, we would like to thank each and every one of you who are present here with us till now. So thank you so much. Without you, it wouldn't have been possible conducting this webinar here. So looking forward for conducting more and more sessions with you participants. So we wish to see you in future as well. So wishing you a very good night. So I'm bidding adieu for the day. Thank you so much, everyone. Thank you.
Thank you.
Good night.
Thank you, ma'am. And that's a wrap to the wonderful session. And once again, I would like to thank our guest, Dr. Rex J. Joseph, for sharing your deep knowledge on AAT. And I would like to thank all the participants for your unwavering attention and thought throughout these presentations. Now, the e-certificates will be provided within 1 week, and the link for the e-certificate will be given through the mail. So thank you once again. Thank you for your cooperation. Thank you.
All right.